Welcome to the Deep Dive. This is where we take a stack of sources you've shared with us, articles, reports, research, and really unpack the most important insights.
That's right. We try to give you that shortcut, to being truly well-informed without getting totally lost in the weeds.
Think of us as your guides, helping you connect the dots on complex topics.
Exactly. Making sense of it all and hopefully making it stick.
And today, we are doing a deep dive into a topic that touches millions of lives right across the U.S. We're talking about utility assistance programs.
Yeah, that whole complex safety net, or maybe patchwork is a better word, designed to help households access essentials like energy and water.
And this deep dive is actually presented through the lens of what we're calling a Civil XR Perspectives podcast. We're using our expertise. I'm Carla.
And I'm Sanjay. And we're guiding you through some really fascinating new research on this.
Our main source for this is a pretty comprehensive report. It's titled Utility Assistance in the U.S. Bridging the Participation Gap, and it's by Civil XR.
Right, and it does a detailed analysis looking at how these programs work across, federal, state, and local levels. A multi-layered view.
So the mission for this deep dive is really to understand the current landscape of this aid, figure out the biggest challenges it's facing,
and crucially, uncover some of the promising strategies that are emerging to make sure help actually reaches the people who need it most.
because the report highlights something kind of surprising right up front, doesn't it?
It really does. Despite billions, literally billions of dollars flowing into these programs every year, millions of eligible households just aren't getting the help. They qualify, but they don't receive it.
Wow. So the problem isn't necessarily a lack of need.
Oh, the need is undeniably vast. The report makes that clear. But it argues the bigger issue often lies in how the programs themselves are, well, designed and administered.
Okay, so there's this big gap, this participation gap they talk about, between who should be getting help on paper and who actually is signing up and getting it.
Precisely. And this isn't just like an academic exercise for Civil XR. They're actively working on this.
Right. The report mentions their focus on helping communities with utility customer assistance programs, UCAPs, specifically trying to find practical ways to close that exact gap we're talking about.
So this report really digs into the why behind that work. What's driving this gap?
And what's truly foundational here, right at the start of the report, is how they frame the whole challenge.
Yeah, they point out that access to affordable, reliable energy and water, it's not just a modern convenience, is it?
No, not at all. It's fundamental, a prerequisite for public health, for economic stability, even just for basic social participation in life today.
And the report actually defines energy and water insecurity not just as, lacking a service, but as critical indicators of systemic poverty. It's about the inability to meet these absolute basic household needs.
Which leads to these incredibly tough situations for millions of families. The report talks about the untenable choices people face.
It's stark, isn't it? Imagine having to decide, do I pay the electric bill this month or do I buy enough groceries?
Or do I put off fixing that leak that's making my water bill skyrocket because I need that money for medicine right now?
Exactly. These aren't abstract problems. They're agonizing, impossible decisions people are forced into because of tight finances and the high cost of utilities.
So, okay, the need is huge. And in response, this system of assistance programs has sort of evolved over time.
Evolved is the right word. The report is very clear this wasn't some master plan. It describes the current system as a fragmented patchwork. Really emphasizes that fragmentation.
Okay, a patchwork. So how does that patchwork actually fit together? The report breaks it down into layers, right?
Yeah, 4 primary levels of governance and action. They're distinct, but they're also deeply interconnected. You really need to understand all 4 to see the whole picture.
All right, let's walk through them. First up, the federal level. The report calls it the financial wellspring.
Apt description. The federal government's main role is setting the broad policy mandates and, critically, providing the core funding. Billions of dollars each year appropriated by Congress.
And this is where we see the big programs like LIHEAP, the Low-Income Home Energy Assistance Program, and WAF, the Weatherization Assistance Program.
Exactly. And that money typically flows out as block grants. It goes to states, tribes, territories.
So the federal agencies like HHS for LIHEAP or the Department of Energy for WAP, they set the big picture rules, the high-level goals, eligibility guidelines.
Right. But, and this is key, they don't usually interact directly with the households seeking aid. The actual hands-on implementation, that gets delegated down.
Which brings us directly to the state level. The report calls this the crucial administrative middle layer.
And that's because states take those federal block grants and then they design the specific programs that operate within their borders. This is where the nitty-gritty rules get made.
Like the exact income limits, although they have to stay within federal guidelines.
Right, within that federal corridor. But states decide the specific benefit levels, how aid is calculated, even when people can apply the application periods. They're the architects of the on-the-ground rules.
And they oversee how the money is used within the state.
Primarily, yes. They provide that oversight function.
Okay, so federal funds it, state designs it. What's next? Closer to the ground.
Exactly. Next, you have the municipal and utility level. So cities and the utilities themselves, whether they're public, like a city water department, or private energy companies, they're the direct point of contact for most residents.
And this level is interesting because they often have their own assistance programs, right?
Right.
Separate from the state-run federal ones?
Often, yes.
Yeah.
They might run in parallel, sometimes coordinate. The report points out these local programs can often be more nimble and innovative
Why is that?
because they're dealing directly with customer issues day in, day out. They see the immediate needs. So you might see utilities offering things like plumbing repair help or unique bill discount structures, maybe emergency aid funded by local donations.
Things tailored to their specific customer base.
Precisely. And the report suggests this local level is where a lot of the most promising new strategies for actually improving access and making programs work better are being tested right now.
Okay, interesting. And the fourth layer?
The fourth layer is the nonprofit or community level. The report describes them as the essential connective tissue, holding this fragmented system together.
Connective tissue, I like that. So what do they do?
They are absolutely vital. States and cities almost always rely on nonprofits, especially community action agencies, CAAs, as their frontline delivery partners.
So the state designs the program, but the nonprofit actually delivers it.
In many, many cases, yes. They handle critical stuff like outreach, actually finding eligible people in the community. They engage directly with residents, provide that crucial hands-on help with filling out applications, gathering documents.
Dealing with all that administrative burden we talked about?
Exactly. And sometimes they even distribute the funds directly. The report stresses their deep community roots and the trust they build are indispensable for reaching vulnerable folks who might not engage with government agencies.
And things like the 211 helpline fit in here, too.
Yes, central referral services like 211 play that crucial connective role, too, linking people to whatever aid might be available nearby.
Okay, so 4 layers. Federal, state, municipal utility, and nonprofit, all involved.
Right. And the big consequence of this multi-layered, often kind of disconnected system, according to the report, it means a resident's ability to actually get help heavily depends on where they live, their specific state, their specific town, or utility service area.
Which creates, as the report calls it, significant geographic variability.
Huge variability. What's available, how you apply, how much help you get, it can look completely different just by crossing a state line. It really is a patchwork of access.
All right, let's dive a bit deeper then into that federal foundation, since that's where most of the money starts. The report really focuses on LIHEAP, calls it the cornerstone.
It is the cornerstone. LIHEAP is the largest federal program for utility assistance, started back in 1981. Its core mission is focused specifically on helping low-income households, especially those already paying a high chunk of their income on energy, meet their immediate home energy needs.
So heating and cooling bills, primarily.
Yes. And it's run by the Administration for Children and Families under HHS. But like we said, it's a block grant. Money goes to states, tribes, territories. You apply through your state or tribal office, not the feds directly.
And the report brings up a really critical point about LIHEAP funding. It's not guaranteed year after year.
That's a major challenge. It's subject to annual appropriation by Congress. So the funding levels can see significant year-to-year fluctuation.
They give an example, right? Fiscal year 23 versus 24.
Yeah, a stark one. Funding was $6.1 billion in FY23, but for FY24, it dropped to $4.1 billion.
Wow, a $2 billion drop. That must create enormous instability for the states trying to run these programs. How do you plan? How do you guarantee benefit?
It's incredibly difficult. That unpredictability impacts everything. Benefit levels, staffing, outreach efforts. It makes consistent operation very challenging.
Okay, so unstable funding. What about who qualifies? How is eligibility determined?
States have flexibility, but they have to operate within a federal corridor. Their income threshold can't be higher than the greater of 150% of the Federal Poverty Guidelines, FPG, or 60% of the state median income, SMI.
And it can't be lower than.
Can't be lower than 110% of FPG. So there's a band they have to stay within.
And the report uses Pennsylvania and Mississippi to show how states can set different thresholds even within those rules.
Exactly, illustrating that state-level variation. The report also stresses that LIHEAP specifically targets vulnerable populations. Priority often goes to households with elderly members, people with disabilities, or young children, usually defined as 5 or under.
And the scale is huge, right? How many households did it reach in FY23?
The national numbers are significant. LIHEAP served an estimated 5.9 million households across the country that year.
And the breakdown, who are those households?
Good question. About 2.4 million included an older adult, 2.1 million had someone with a disability, and nearly 1 million households included a young child, 5 or under.
And what kind of help did they get? Was it mostly heating?
Mostly, yes. About 5 million households got heating assistance, but also nearly 1,927,000 got cooling help. And importantly, there were 1.4 million instances of crisis assistance.
Crisis assistance meaning, like your furnace breaks midwinter or you get a shut-off notice.
Exactly, those kinds of emergencies. And for folks who want to dig into the numbers, the report mentions the LIHEAP data warehouse as a public resource.
Okay, so LIHEAP is the big one, but it's not the only federal piece of this puzzle.
No, there are other important federal programs that complement it.
Like the Weatherization Assistance Program, WADOVUPO, that's run by the Department of Energy, right?
Correct. And WAP is really different from LIHEAP in its whole approach. It's not about immediate bill payment help. It's proactive, aiming for a long-term fix. It funds energy efficiency upgrades for homes. Think adding insulation, sealing drafts around windows and doors, maybe tuning up or replacing an old, inefficient furnace, sealing leaky ducts.
Ah, things that permanently lower energy use.
Exactly. The goal is to reduce the household's energy bills for years to come, making the home more affordable long-term.
And who qualifies for WAP?
Eligibility is often linked to other major safety net programs like TANF, Temporary Assistance for Needy Families, or SSI, Supplemental Security Income. It helps target households already identified as being in significant need.
What about phones and internet? Are they considered utilities in this context? The report mentioned the Lifeline program.
Yes, the report includes Lifeline, which is run by the FCC, the Federal Communications Commission, and it really reflects the reality that today phone and internet aren't luxuries. They're essential utilities.
For emergencies, jobs, school.
Absolutely. Lifeline provides a monthly discount on broadband or phone service to make sure low-income households can afford that basic connection needed for, 911, job searching, road education, telehealth, all of it.
And then there's a program the report really highlights because it pointed to a major gap, especially during the pandemic, LIHEAP.
Yes, the Low-Income Household Water Assistance Program. The report is pretty direct here. It says the COVID-19 pandemic exposed a significant gap in the federal safety net.
The gap being no ongoing federal help specifically for water bills, like LIHEAP does for energy.
Precisely. There was no prominent nationwide program. So LIHEAP was created as a temporary response funded through COVID relief acts like the Consolidated Appropriations Act and ARPA.
It gave emergency help for water bills during the crisis, which was desperately needed.
Absolutely needed. But the report stresses its temporary nature and the consequence. They give the example of the Texas Utility Help Portal, which offered both water and energy aid, having to just shut down because requests completely overwhelmed the limited temporary funds available.
So when the money ran out, the help stopped.
Exactly. And the report argues this clearly underscores a critical, unmet need for ongoing federal support for water affordability. Without a permanent federal program, water help is mostly left to states and local utilities.
Leading to more of that inconsistency and patchwork access?
Right. So summing up the federal level, it provides the bulk of the funding, sets a broad framework, but it's a framework that's historically been heavily weighted toward energy assistance.
And that history creates, as the report says, a systemic vulnerability for households facing rising water and wastewater costs. They often fall through the cracks at the federal level.
Yeah, that seems to be the conclusion. And while reaching 5.9 million households with LIHEAP is impressive, the report reminds us that number only represents those who successfully got through the complex process.
It doesn't show the full need, or how many eligible people didn't get help, or how much access varies state by state.
Exactly. Which brings us logically to Section 3 of the report, state-level implementation. This is where that federal money gets its form and function on the ground.
Right. States administer those block grants. They have to submit an annual state plan to HHS saying how they'll use the LIHEAP money, for example.
And this is where you see that considerable discretion states have. It's both a strength and a weakness of the system.
Discretion in what areas?
They decide the specific benefit amounts, how much money a household gets. That can vary based on income, household size, even the type of heating fuel used. They set the application periods.
Like the example of Pennsylvania's LIHEAP season running November to April, targeting the cold months.
Exactly. And crucially, states decide the primary delivery mechanism. How does the aid actually get to the residents?
And the report says the most common way is through nonprofits.
Overwhelmingly, yes. Contracting with nonprofits, especially those community action agencies, CAAs, is the dominant model, which means the actual capacity and performance of those local nonprofits are absolutely critical to how well the state's program works for people.
So the state makes the rules, but local nonprofits often carry them out.
That's often the case. And the report uses several state examples to show just how diverse these administrative models can be.
Let's hear some. Pennsylvania.
Pennsylvania uses a tiered benefit structure. They offer regular cash grants ranging from $200 to $1,000 based on need. And they have separate crisis grants for emergencies, like a broken furnace or facing shutoff. They also try to be transparent by publishing their income eligibility tables online.
Okay. What about New Jersey? They had a different approach.
Yes. New Jersey is highlighted for a more integrated approach. They have a single, unified application form. One application lets you apply for LIHEAP and a state-run energy assistance program called the Universal Service Fund, USF, and weatherization assistance all at once.
Oh, that sounds much simpler for the applicant.
The report says it significantly streamlines the process. And they back it up with a statewide toll-free hotline for help, but they still direct applicants to local CAAs for the actual processing. So it's kind of centralized info, decentralized delivery.
Interesting. What about Alabama?
Alabama uses a highly regionalized model. The state agency, ADECA, divides the state into 11 regions, and each region has one specific CAA responsible for handling LIHEAP and WAP there.
So if you live in Alabama, you need to know which CAA covers your specific county.
Pretty much. Each agency has its own contact info, website, sometimes its own online scheduling. It's a network of localized hubs.
And Mississippi, they had a digital component.
Mississippi uses a two-step process, digitally fronted. You start with a pre-application online through a state portal called Access MS. That info then gets sent to your local CAA.
Who then contacts you for a full in-person application appointment.
Exactly. So it's a hybrid model, trying to blend some online convenience with the traditional in-person verification requirement.
And Illinois, the report mentioned something about transparency there.
Yeah, Illinois brands its programs as Help Illinois Families. And a notable feature is an online tool where applicants can actually check the status of their LIHEAP application.
Oh, that's useful. Reduces the need to keep calling to ask what's happening.
Right, adds a layer of transparency to what can often feel like a black box.
Okay, so synthesizing these state examples, lots of different ways to do it. The report calls it a laboratory of democracy.
It does. States trying different approaches. But the big trade-off, the report argues, is that all this flexibility creates a confusing and often inequitable system for the people trying to get help.
I can definitely see that. Your experience depends entirely on which state you're in. Moving from New Jersey's single online app to Mississippi's two-step process, that's a completely different world.
Totally different system, different bureaucratic hurdles. This patchwork of access makes clear communication really hard and puts a significant navigational burden on low-income families who often have the fewest resources to deal with it.
So local tailoring comes at the cost of simplicity and equity for the person needing help.
That's the core tension the report identifies at the state level.
Okay, so if states are the middle layer, the report suggests the real innovative energy is often happening even closer to the ground at the local level. Section 4 looks at municipal and utility innovation.
Yeah, the report argues this level, cities and utilities, is where a lot of the most instructive innovation is happening because they're in direct contact with customers daily, dealing with the on-the-ground realities.
And the report mentions CivilXR actually tracks these kinds of local programs.
Yes, they maintain a database for their own research and development into what works, which is likely why these city examples are featured so prominently. They offer concrete case studies.
And the first deep dive is Austin, Texas. They call it a data-driven model of automatic enrollment. Sounds promising.
It's a really compelling case study. Austin has a couple of key programs. The Customer Assistance Program, or CAOP, gives ongoing bill discounts, saving folks $560, $650 a year on average. And then there's plus one for emergency aid delivered through dozens of community partners.
Okay, but they had a problem, right? With the ongoing discounts, the CAP program.
A big problem. Despite the significant savings, participation was really low. Only 37.5% of eligible customers were actually enrolled back in 2022.
Less than half. Why?
The report points squarely at administrative burden. The hassle of applying, the paperwork, the verification, it was the primary barrier keeping people from getting those ongoing discounts.
So what did Austin do? What's the central innovation?
They fundamentally flipped the script on enrollment. Instead of making eligible people find the program and actively apply the traditional opt-in model, they moved to a proactive, automatic, opt-out enrollment system.
Automatic enrollment. How does that work? How do they know who's eligible?
Through strategic data sharing partnerships with state agencies. This is key. Austin Energy, the utility, uses a secure third-party vendor to cross-reference its customer data with state lists of people already enrolled in other known low-income programs.
Like SNAP food assistance or Medicaid health insurance or the Children's Health Insurance Program, CHAP.
Exactly. If a customer shows up on both the utility list and one of those state program lists, it's a very strong indicator they meet the income requirements for the CAP discount.
So they just enroll them.
Yeah,
automatically.
they enroll them automatically in the CAP discount program. Then they notify the customer, say, hey, you're enrolled, you'll start seeing savings, here's why. If you don't want this, let us know. But the default is providing the help.
Opt out, not opt in, and the results.
The report calls them quantifiable and profound. Enrollment absolutely skyrocketed. It went from maybe 4,000 or 5,000 households back in 2011 under the old opt-in system to an incredible 63,732 households participating by mid-2024.
Wow. That's a massive difference. What did that do to the participation rate among eligible people?
It jumped from that low 37.5% all the way up to 71%.
Yeah.
And Austin isn't stopping there. They have an ambitious target to reach 90% participation.
And 63,000 households. What does that represent in the context of the whole city?
It means about 14.5% of all households in Austin are receiving this utility assistance through CAP. The report concludes Austin is a clear, data-backed blueprint showing how data and automation can totally transform program effectiveness and really bridge that participation gap.
Okay, very impressive. What's the next city example? San Antonio, Texas. A different model.
Yes, San Antonio focuses on SAWS, their publicly owned water utility. The report highlights their service integration model.
Service integration. What does that mean in practice?
It means they took a really customer-centric approach. They pulled together all 14 different types of customer assistance programs they offer.
Everything from discounts to repair help.
Right, and they put them all under one single, easy-to-recognize brand, SAWS Uplift. And critically, they created a single, streamlined application form for all of it.
Ah, so the core innovation is simplifying the experience for the person applying.
Radical simplification. You fill out one application. Then SAW WS staff figure out which of the 14 programs you might be eligible for. The applicant doesn't have to be an expert on their programs or navigate multiple processes.
That makes so much sense. And what kinds of programs are under that Uplift umbrella?
The report says it's remarkably broad and holistic. There's an ongoing affordability discount. And get this, it tiers the rate so the first 2,000 gallons of water each month are actually free for eligible low-income customers.
Free. Wow.
Plus emergency aid, called Project Agua. Plus a free plumbing repair service for homeowners called Plumbers to People to fix leaks that drive up bills. Plus waivers for things like late fees and deposits. It really tries to cover affordability from multiple angles.
And how do they reach people? Is it just waiting for applications?
No, the report highlights their proactive outreach. They actually moved the administration of Uplift into the Utilities Community Outreach Department. This team takes an active in-person approach.
Meaning they go out into the community.
Exactly. Meeting residents in their communities, at community centers, schools, churches, instead of making people come to a formal utility office. The report calls it a very people-first approach.
And the results in San Antonio, how many people are they reaching?
As of April 2023, the report cited nearly 32,000 households participating. That's about 5.8% of all households in San Antonio. A holistic and accessible model, according to the report.
Okay, Austin with data automation, San Antonio with service integration. What about Houston? What model does it represent?
Houston illustrates what the report calls a multi-agency, nonprofit-led model It's more decentralized. A complex partnership involving the city utility, maybe city funds, but heavily relying on large, independent nonprofit organizations to deliver aid.
So less centralized control, leveraging existing nonprofits.
Right. Houston does have a direct but limited city water assistance program called the WATER Fund, just $100 every 6 months for low-income seniors and disabled folks in single-family homes.
Pretty narrow scope.
Very narrow. The report points out that a lot of the aid available in the Houston area, especially for energy bills, comes via third-party nonprofits funded by the state agency TDHCA. This provides more substantial aid, up to $1,800 a year.
But it's administered by separate nonprofits, not the utility or the city directly.
Correct. And the source material does note some criticism raised about this model, specifically mentioning concerns about very high executive compensation of over $4 annually at one prominent nonprofit administering large amounts of these aid funds. That's a potential challenge with decentralization.
And is the aid easy to get in Houston?
The report highlights immense demand. They describe specific application windows opening for a limited number of slots.
They get filled within hours.
Often, yes. Which clearly signals that the need there far outstrips available resources.
What's the big challenge with this kind of decentralized, nonprofit-led model, according to the report?
A key issue is tracking the overall picture. Consolidated participation statistics are not readily available. It's hard to know exactly how many unique households are being helped across all the different programs run by different entities.
The report mentions another study by the Alliance for Water Efficiency.
Yes, noting that relatively few households seem to be taking advantage of available water assistance in Houston and recommending better tracking. So that lack of clear, aggregated data is a key finding for the Houston model. Fragmentation makes comprehensive measurement difficult.
Got it. Okay, one more city, Dallas. Their model sounds different again. Community donation model.
Yes, this focuses on Dallas Water Utilities, DWU, and their program Operation Watershare, which has actually been around since 1993.
And the defining feature, how is it funded?
It relies purely on community solidarity. Funding comes from voluntary donations made by other DWU customers. People can add a donation to their water bill or send a check. It's literally neighbors helping neighbors.
How is it administered?
By the City Housing Department, working with local community centers.
Okay, noble concept. But what are the limitations?
The report points out significant limitations. The assistance is pretty modest $100 maximum, and only once per year per household.
So the reach isn't huge.
Very limited reach. It helped just 951 customers in 2023 and 843 the year before. They do have a separate, useful program for minor plumbing repairs to fix leaks, but the direct bill assistance is small scale.
And 951 customers in a city the size of Dallas. What percentage is that?
Tiny, just 0.18% of all Dallas households in 2023. So the report concludes that while these donation programs foster goodwill, they simply cannot function as a comprehensive solution for widespread affordability challenges.
Okay, so 4 cities, 4 different models, Austin, San Antonio, Houston, Dallas. What's the takeaway when you compare them?
The report is clear. There's no single best model. It's really a spectrum of strategies, and each comes with clear trade-offs.
Right. Austin gets amazing scale and participation with automation, but maybe less nuance for complex cases.
Exactly. San Antonio's integration is great for the customer, very holistic, but needs significant internal capacity at the utility.
Houston leverages nonprofit strengths and reach, but struggles with fragmentation and data tracking.
And Dallas taps into community generosity, which is valuable. But the impact is inherently limited compared to the scale of the need.
So the choice of model reflects different priorities.
It's a strategic decision reflecting priorities.
Yeah.
But, the report argues, the data, especially from Austin, strongly suggest that if your primary goal is closing that eligibility to enrollment gap and reaching the maximum number of qualified people,
then low-friction, data-driven, automated models are the most effective way to do that.
that seems to be the conclusion for maximizing participation. However, the report is quick to add that even those super-efficient models need to be complemented by robust, accessible emergency programs, like Austin's own Plus One network run by nonprofits.
For those immediate crises that automation alone can't solve.
Exactly, which points towards a hybrid strategy as probably being the most resilient and effective overall, combining the efficiency of automation for ongoing help with high-touch, community-based support for emergencies.
That makes sense. And speaking of community support, that brings us to Section 5, focusing on the third sector, the nonprofits. The report calls them the system's connective tissue.
Yeah, it really circles back to emphasize their constant and essential presence throughout this whole landscape, from
Yeah.
influencing policy to actually delivering aid locally. In many places, they are the critical infrastructure.
We saw that in the state examples, right? Alabama, New Jersey, Mississippi, almost universal delegation of LIHEAP administration to nonprofits like CAAs.
Absolutely. And the report details why they're so invaluable. They fill roles government agencies often can't do as effectively.
Like what? What are their key functions?
First, outreach and trust. They have deep community roots. They can build trust with vulnerable groups who might be skeptical of government. They can reach people who are isolated or harder to find.
That trust factor is huge, I imagine.
Crucial. Second, application assistance. We talked about administrative burden. Nonprofits provide that essential hands-on support, helping people understand the forms, gather the documents, overcome barriers like language, disability, or lack of internet access. They bridge that bureaucratic gap.
And third,
Holistic support. This is unique because a household struggling with utilities often faces other challenges: food, housing, health. Nonprofits are often positioned to provide wraparound support.
connecting the dots for people, linking utility help with food banks, housing aid, financial literacy classes.
Exactly. Addressing the person's or family's needs more comprehensively.
So the report really emphasizes how much the whole system relies on these nonprofits.
It makes a critical point. The system's ability to reach people in need is inextricably linked to the health, the capacity, the funding, the stability of this nonprofit delivery network.
Which means any serious policy discussion about improving utility assistance has to include strengthening that nonprofit infrastructure itself.
Absolutely.
Yeah.
Things like stable, multi-year funding for their operations, capacity building support, streamlining burdensome requirements. It's essential for the whole system to function well.
Okay, so all this analysis, the fragmented system, the different levels, the role of nonprofits, it all leads back to the core challenge identified at the start, bridging the participation gap. Section 6 tackles this head on.
Right. The report clearly defines this gap, the difference between who's eligible and who's actually enrolled, as significant and persistent. It's not just a minor issue. It's framed as a fundamental challenge, a systemic problem, even a failure of the system itself.
And they use those stark examples, right? Austin being at only 37.5% before their changes, and mentioning participation rates in some places falling far below 1% of the total population.
Yeah, the bottom line is stark.
Yeah.
Millions of households who qualify for vital help with basic necessities are simply not getting it. And again, the report stresses, this is not because those families don't need the help.
So the crucial question the report digs into is, why? Why does this massive gap exist? What are the barriers stopping people?
Let's unpack those barriers. The report identifies several key ones. First, and arguably the most significant barrier, is administrative burden.
All that complexity we've been talking about, the long forms, the piles of documents needed.
Exactly. Complex, lengthy forms, extensive documentation requirements, proof of income, residency, household members, sometimes utility bills going back months. The report uses terms like time tax and administrative sludge to capture the sheer effort and difficulty this imposes.
It's more than just an annoyance, it's a real obstacle. Taking time off work, getting childcare, transportation.
Finding the right documents, understanding confusing language. The Austin audit specifically found that secondary verification steps were tripping people up even after they seemed to qualify initially. The process itself actively deters people, especially those with the fewest resources to navigate it.
Okay, so administrative burden is huge. What else?
Lack of awareness. People just don't know these programs exist. Or maybe they've heard of them, but mistakenly think they won't qualify.
And outreach efforts are often too passive.
Often, yes. Relying on people finding info online or seeing a flyer. This misses folks who are isolated offline or don't engage with typical channels.
Then there are logistical hurdles. The practical stuff.
All right, lack of transportation to get to an office, inability to take time off an hourly job without losing pay, not having a computer or reliable internet for online applications. These practical barriers are insurmountable for many.
The report also mentions stigma.
Yes, the shame or embarrassment some people feel about needing or asking for help. That can absolutely prevent someone from even starting the application process.
And finally, there's something called program churn. What's that?
This is a big one, especially for ongoing programs. Many require annual reapplication and re-verification. You have to prove your eligibility all over again, every single year.
Even if your situation hasn't changed.
Often, yes. The report notes some nonprofits require a brand new application with all the documents every year. This creates a constant risk of households churning out of the program, losing their benefits just because they miss a deadline, can't face the paperwork again, or fall through the cracks during re-verification.
Okay, so multiple significant barriers contributing to this participation gap. But the report doesn't just diagnose the problem, right? It offers solutions.
Exactly. And the framing is key. This isn't an intractable problem. It's largely a design problem. And design problems can be solved with better design. The report details proven strategies for closing the gap.
And top of the list seems to be that Austin model.
Automatic and data-driven enrollment. The report calls this the single most powerful strategy based on the evidence. Austin's success is the prime example. It fundamentally shifts the burden.
From the individual having to prove eligibility to the system using existing data to proactively identify and enroll people.
Exactly. Through secure interagency data sharing and implementing opt-out enrollment, San Antonio automatically enrolling seniors is another example of using data this way. What else works? Simplified integrated applications, like the Sotheby's Uplift model in San Antonio. One application, one point of entry for multiple forms of help. It dramatically reduces the cognitive load and confusion for applicants.
Makes sense. Less for the applicant to figure out.
Third, proactive, in-person outreach. Moving away from just passively waiting for people to apply and instead actively going out into communities, meeting people where they are, offering help, like the Sotheby's Community Outreach Team.
Building relationships, not just processing forms.
Precisely. And fourth, lowering documentation barriers. Every piece of paperwork you can eliminate, every verification step you can streamline, makes a difference.
The Sotheby's example of using a third-party vendor for electronic income verification instead of paper or pay stubs comes to mind.
Yeah, it's a perfect example of using technology to remove a major friction point.
So the report's conclusion on this section feels like a real call for a change in perspective.
A crucial paradigm shift. Low participation isn't mainly because applicants are unmotivated or don't care. It's the predictable result of systems that are poorly designed, too complex, too fragmented, and place the heaviest burden on people with the fewest resources to cope.
So the biggest gains won't come from just more marketing.
No, they require fundamental re-engineering of the systems themselves. It demands a shift in mindset within agencies and utilities, moving away from being a gatekeeper primarily focused on verifying eligibility and preventing fraud.
Often at the cost of making it too hard for eligible people to get through.
Right. Shifting from that gatekeeper role to being a proactive service provider, where the main goal is to actively find and enroll eligible households with the lowest possible barrier.
That's a powerful reframe, which brings us to the final section, Section 7, Synthesis and Recommendations. Pulling it all together.
Yeah, the report synthesizes the key findings we've walked through. This fragmented ecosystem, federal, state, local, nonprofit. The federal funding being heavily weighted to energy, leaving that water gap. State administration creating the confusing patchwork. The participation gap being the fundamental challenge.
But also the positive findings.
Absolutely. That local innovation, especially in Austin and San Antonio, proves the gap can be closed. Proven strategies exist: automation, integration, outreach, the crucial role of nonprofits, but their need for stability. And that essential need for a paradigm shift towards low-friction, customer-centric design.
So, based on all that analysis, the report offers concrete recommendations, starting with policymakers at the federal and state levels.
Yes. First, a big one. Create a permanent federal water assistance program, like LIHEAP for energy. The temporary LIHEAP showed the need is ongoing. We need stable, permanent federal funding for water and wastewater affordability.
Makes sense, fills that systemic gap. What else for policymakers?
Incentivize and fund data sharing initiatives. Follow Austin's lead. Create federal and state grants. Provide technical help. Smooth out the legal hurdles so agencies and utilities can build the secure systems needed for data sharing. Link those utility lists with SNAP, Medicaid, TNF rosters.
Encourage that automatic enrollment pathway.
Exactly. Third, standardize and simplify core elements. HHS and other federal agencies should lead efforts to create more standardized application components and verification methods that states can adopt. Not to eliminate state flexibility entirely, but to create a more seamless experience for residents, reduce confusion, cut redundancy.
Especially if people move between states.
Right. And fourth, for policymakers, provide stable, multi-year funding for nonprofit partners. Recognize them as critical infrastructure. Move away from unpredictable annual grants. Give them stable, multi-year funding for their core operational costs so they can build capacity, retain staff, and be reliable partners.
Okay, strong recommendations for government. What about for the utility providers and their regulators?
Also clear actions for them. First, prioritize and invest in closing the participation gap. Make percent of eligible population served a core key performance indicator, a KPI for utility customer service and assistance teams.
Put it on the dashboard, make it a priority.
Exactly. Set ambitious public targets like Austin's 90% goal. Drive accountability and innovation internally.
Second,
Adopt a low-friction design philosophy. Review all customer processes, especially applications, top to bottom with the specific goal of removing friction. Use mobile-friendly portals, cut documentation where possible, use tech like third-party income verification. Make it easy.
third, for utilities.
Proactively forge data-sharing partnerships. Don't wait for a mandate. Initiate conversations with your state and county social service agencies. Figure out how to set up secure agreements for automatic or streamlined enrollment based on their existing program data.
Get the ball rolling themselves.
Yes. And fourth, integrate assistance into core customer operations. Don't silo these programs off. Embed awareness and access within regular customer service billing, community outreach like SOSS did. Train all frontline staff to spot customers who might be struggling and be ready to offer help.
Make it part of everyone's job to connect people to assistance.
That's the idea.
And finally, the report has recommendations specifically for the nonprofit organizations themselves.
Yes, recognizing their vital role. First, advocate for systemic change. Use their on-the-ground knowledge of barriers to push utilities, regulators, legislators for things like simplified applications and automatic enrollment. Highlight how these changes would actually free up their time from paperwork to focus on direct service.
Use their expertise to push for smarter systems.
Exactly. Second, build data collection and analysis capacity.
Yeah.
Invest internally to track client outcomes, demonstrate impact, and provide solid data back to policymakers showing where the gaps are and advocating for resources. Address that Houston data fragmentation issue head-on.
Data for impact and advocacy.
And third, form strategic alliances and coalitions. Work together with other nonprofits in their area, coordinate services, share best practices, and advocate with a stronger, unified voice to funders and policymakers for changes that benefit the whole community.
Okay, so that brings us to the end of this deep dive. We've really journeyed through a complex landscape, haven't we? Federal funding, state rules, local action, nonprofit glue, all focused on this core problem of the participation gap.
It's complex, but the core takeaway from this CivilXR report feels remarkably clear and honestly hopeful. That gap, the fact that millions miss out on help, it isn't inevitable. It's largely a product of system design.
And because it's a design problem, it's solvable with better design. Proven solutions exist.
It really boils down to that paradigm shift we talked about, moving from a system that forces people through hoops to prove their poverty to one that actively seeks to connect them with the help they need and are eligible for.
It really makes you think, doesn't it? The final provocative thought, maybe? What does it say about us as a society when essential help for basic needs like water and heat is technically available, but the system to access it is so hard to navigate that many, maybe most eligible people just can't get through?
Yeah, and how can we, now that we're more informed through analyses like this, encourage that shift in our own communities?
Yeah.
Pushing our local utilities and agencies to move from being gatekeepers to being proactive service providers.
A lot to chew on there. Definitely a powerful analysis with clear pathways forward.
Absolutely.
Well, thank you for joining us for this deep dive into utility assistance in the U.S., seen through the lens of the CivilXR Perspectives podcast.